When the color of your skin is seen as a weapon, you will never be seen as unarmed. Please hear me. When the color of your skin is seen as a weapon, you will never be seen as unarmed. As a doctor, I've witnessed this. As a daughter, I've experienced this. As a mother, I fear this. As a patient, I know this. I know the impact of being a threat has on the mind and on the body. Ta-Nehisi Coates wrote a letter to his son. All our phrasing, race relations, racial chasm, racial justice, racial profiling, white privilege, obscures the fact that racism is a visceral experience. It dislodges brains, blocks airways, rips muscle, extracts organs, cracks bones, breaks teeth. The sociology, the history, the economics, the graphs, the charts, the regressions, they all land with great violence upon the body, and I would add, upon the mind. You see, the reason for this is myriad. We know from the data, mental health morbidity higher in Black Americans, reports of higher psychological distress, higher rates of suicide. But despite this burden, only a fraction, a quarter, seek relief in the mental health system. I hear a lot of reasons, but the reason I hear the most, beyond the stigma, the shame, the social and structural factors, is the system doesn't look like me, doesn't want me, doesn't feel me, doesn't care about me. It doesn't see me. It's not there for me. The bias, the historical trauma that science and medicine has wrought upon the Black American community are some of the many reasons. It affects families, patients, even patients like Mrs. D.
Miss D was a patient that walked into my clinic one Wednesday afternoon. She's a 38-year-old woman with advanced HIV. Miss D had been to numerous providers over the years and had been on life-saving medication on and off for many, many years. But today she came into my clinic and said, I just can't do it anymore. I'm done. You see, Miss D is a single mom. She has a toddler and a teenager. She lives in government-subsidized housing, which she says is not safe for her children. And she has been to numerous mental health providers over the years, therapists, psychiatrists, counselors. Nothing's helping her. As I sat there and talked to her in the clinic that day, I thought, what can I do to help Miss D? Because I knew until her mental health issues were addressed, there was nothing I could do about her HIV and her physical symptoms. The issue is, Miss D doesn't trust the healthcare system. You know, when I was in school and I was trained as a nurse practitioner, I was trained to see Miss D's condition as a medical problem. But Miss D's problem is not a medical problem. Miss D's problem is a wicked problem. Wicked problems are always the symptom of something else. Wicked problems have a number of solutions and approaches, but with no right answer. And wicked problems have no definitive formulation. So it was in that moment I thought, what am I gonna do here? What am I gonna do for this patient? When certainly it wasn't getting done in the clinic.
The clinic, the health system, society, the gap between what the health system has promised and what its institutions have delivered is wide. Bias, lack of access, the list is long. No literacy, no health literacy, no education, and a safe space that teaches people between a social and historical context how to handle some of these issues that they deal with. How do we bridge that gap? What do we do?
The answer in bridging that gap is an embedded education. Embedded education is simply bringing education into spaces and systems that exist for non-educational purposes. It's actually a brilliant idea. So you're actually utilizing these spaces that already have social relations and social networks as a part of them to bring in education and things, and particularly in healthcare, to advance health and reach people in a way that you couldn't do otherwise in the healthcare system. It's a more equitable system. So the question is, for us in our community, is where are we going to do this? What are the places that would be appropriate in this community?
And so we came upon the concept of the third place. The third place was talked about in the 1990s. The first place being home, the second place being work, and the third place is a place that is neither of those two. They're equalizing spaces, they're levelers, it's neutral ground. It's where you go, like Cheers, where everybody knows your name. And the thought is, the health system is not reaching so many people, but the third place could. What sorts of third places? Post offices, pubs, laundromats on a Saturday morning, church on a Sunday. But where we landed was in the barbershop, a historically trusted, culturally appropriate, safe space for Black men. Going into the community, outside of the traditional health system, learning, exchanging, building. This is what we chose. And also, someone is here to tell us more about their experience with our program. Listen to Gil.
At that time, growing up in projects, it was a rite of passage. Seemed to be locked up. So that's the mentality that a lot of young people had. At one time, I did have guns and so forth. I used to like guns because I robbed a lot. And then that's still the mentality that I had that guns was a sense of power. Because once you aim a gun at somebody, they're gonna do whatever you want. So I'm saying these things because my mind was all messed up, for real. And I thank God that I'm here today to say these things because it's about a re-educational process. You know, you have to let go what you have learned, or whatever negative things, and you have to be re-educated to what's going on and the right thing. You know, also, when I talk about mental health, let me clarify some things. Mental health doesn't mean you're crazy at all. Mental health means that you need some assistance. And growing up, I didn't have no way of processing a lot of things, the trauma that I went through. So it was a lot of open wounds that I left undone. And as going through my life, each open wound or whatever, I just put it aside and get with it later. I never got with it later. I never really addressed it. So I compile them on top of one another.
Can you imagine walking down a street where Ms. D and Gil could safely walk into a space where they felt comfortable to learn about mental health and the causes of mental health, slowly chipping away at all the mental health inequity that we see in this community in a non-stigmatizing, non-shameful space? Can you imagine what that could look like? Please join us in closing this great divide in our healthcare system, where we can help Gil and Miss D live a healthy, happy, and productive life.